Welcome to Getting Covered, your guide to the Iowa health insurance marketplace. I'm Tom Moore.
And I'm Karen Vandersand, and you've probably heard about the major changes taking place in healthcare right now as part of the Affordable Care Act. As of January 1st, 2014, all U.S. citizens must have health insurance. In the next 30 minutes, we'll talk about what kind of health insurance coverage is available to you and how to shop for your health care plan on the new Iowa Health Insurance Marketplace.
We'll also show you different ways you can enroll, where to enroll, and the kind of information you might be asked to provide. You'll also meet some Iowans who are enrolling and hear how they're navigating the new system. First, let's find out more about the Iowa Health Insurance Marketplace.
The best way to shop the marketplace is to do it online. I know there's been a lot of information in the media about the website not working and not functioning well, but I know here we've had a lot more luck this week in getting applications through, and that's really the best way to get online and compare plans and see what you might be eligible for and what type of tax credits you might qualify for if you're in that income bracket. And so to be able to get online and see that in real time is the best way for patients to do that and to shop for the plan that they're interested in purchasing.
The insurance providers that are available for individuals that are applying in the health insurance marketplace include Coventry and Co-Opportunity. One of the things as a consumer that's important is that if you're happy with the provider that you have currently, that you work with them in understanding which of those alliances would be in network for them to provide services to you. Co-Opportunity and Coventry also provide if you were to go outside of their network, but there might be some higher costs associated with that. So my suggestion, if you're trying to determine which provider to go with, if you do have a current provider, it would be to check with them first to understand what network that they're with.
Well, the plan are quite good, by the way. I think they cover a large amount of needs that people may have. For example, the Silver plan on the exchange is similar to what the state employees are getting. Then including dental, including also psychiatric support and so on and so forth. Then these plans are quite comprehensive in many respects.
The plans that are out there have similar benefit packages, but there's different out-of-pocket requirements and different deductibles. So the core benefits that a patient or a prospective person would have would be similar across plans, but the network and your co-pays and your deductibles may vary depending on your selection.
As part of the Affordable Care Act, everyone can now get quality coverage that fits their budget and needs.
You can get preventive care with no co-pays. You cannot be denied insurance or be charged more for it just because you have a medical condition. Plus, there's no lifetime or annual limits, and low and middle income people will get help to pay for their plan.
If you don't have insurance now, shop the new Iowa Health Insurance Marketplace. It has qualified health plans that meet the federal government's standards and your needs. You can find the marketplace online at www.healthcare.gov. But there are other ways to get enrolled as well.
So a lot of patients have asked this question, like, do I have to apply online? It seems to be the fastest way to complete the application process if you're able to access the online system, but we're aware that some people don't have email addresses or direct access to computers or internet. You can also apply through a paper application process that exists, and also the healthcare.gov has a 1-800 number where people can call and receive assistance with the application process on the phone. And that process we found is very helpful for people who have a lot of questions about not sure how to answer this part of the application. The other benefit to the 1-800 number is that they have people who speak multiple languages that can take that call and assist you. So if English is not your primary language and you're finding yourself having difficulty with the online or the paper application process, you can get help through the 1-800 number as well.
Lynn County has a lot of different other organizations that have stepped up and also offered to become certified application counselors so that they can assist the consumers in navigating through the marketplace. So we work in conjunction with other organizations within Lynn County in order to help people get enrolled.
think it's important to emphasize that we know this process is overwhelming, it's been confusing, and it's new for a lot of people. Find somebody that can help you navigate that system. It's very important, and if you're feeling overwhelmed, it's understandable because this is a new thing for a lot of people, and it's going to be new until people familiarize themselves with the process, until this becomes something that we've done a number of times. So not to be intimidated by it, but rather seek out help because it is available in the communities that people are residing in.
We recognize there's a lot of information out there. It may be overwhelming to folks, but we urge you to go out and seek help. There's people across the state at multiple institutions that are there to help facilitate you getting enrolled and making sure that you have the ability to see the provider who you want. The best thing to do is to go seek that assistance out rather than to wait until you think you need the care.
The new health insurance marketplace is a one-stop shop for people with no insurance, people who pay for their own insurance, and small business owners.
When you get health insurance coverage in the marketplace, you may be able to lower the cost of your coverage by paying lower monthly premiums. This depends on your income and family size. You'll see the amount of savings you're eligible for when you fill out your application. So what if you already have insurance?
You're already considered covered if you have Medicare, Medicaid, CHIP, COBRA, TRICARE, or VA health insurance. You're also considered covered if you have any job-based plan, retiree coverage, any plan you bought yourself, or have some other kinds of health coverage.
If you're eligible for job-based insurance, you can consider switching to a marketplace plan. But you won't qualify for lower costs based on your income unless the job-based insurance is unaffordable or doesn't meet minimum requirements. You may also lose any contribution your employer makes to your premiums. If you have Medicare, you're considered covered and don't have to make any changes. But you can't use the marketplace to buy a supplemental or dental plan.
We'll be back in a moment to talk about how to get enrolled and where you can get help navigating the new Iowa health insurance marketplace.
During my recent physical, my family doctor recommended seeing a specialist. Coordinating my appointments could have been a nightmare. Mercy Care made it easy. Their single electronic medical record meant each specialist and my medical team at Mercy had the same information, my health treatments, recent test results, even any medications I'm taking. Everyone working together helped me get healthy again. That's why Mercy is my medical home. Compassionate, coordinated care. That's the Mercy Touch.
Our first interaction with Dexter's parents came before Dexter was even born. We told them that the odds were less than 50% that he would probably survive, and we asked their permission to give it a shot.
As things started to progress, one of the OBs came in and he looked at how things were going and said, "This is it. We're going to do a C-section."
We then took him to the NICU and started resuscitation.
I was terrified as Dexter was being born because I knew so little about what is possible with a baby who's born at 23 weeks. I didn't think it before I was even in labor that was a baby that could survive.
Being in an NICU is like a roller coaster ride, and Dexter had some ups and downs in his care.
And slowly, as he started to get better and better, we started becoming more reassured that it really was going to be okay. It turns out the doctors were right.
The level of care that a baby receives will determine how that baby does for the rest of his life. There are lots of studies that show that babies born at the highest level centers have a much better outcome. So if you're going to have a premature baby, you really want to have a premature baby at a high level center like the University of Iowa.
I don't think there's a worse thing for a parent to experience than having a child that could die or is so sick. But we're really lucky that it happened here in Iowa, that we have Dexter.
Seeing Dexter now is a highlight of my career, actually. I saw his mom, and she showed me a picture of him looking like a beautiful, happy baby. And I said, "Wow, you just made my day." And she came back with, "Well, you guys made my life."
No one plans to have an emergency, but when it happens, you deserve the best care fast. You deserve the emergency team at Mercy Cedar Rapids. With board-certified physicians, it's door to doctor in an average of 24 minutes. And our single electronic medical record means your health history is always in reach for better, safer treatment, faster. Emergency care at the speed of Mercy. That's the Mercy Touch.
Welcome back to Getting Covered, your guide to the Iowa health insurance marketplace. I'm Karen Vander Sanden.
I'm Tom Moore. So how do you get enrolled in the new health insurance marketplace? One simple application works for everything. In the marketplace, you'll be able to find options that fit your income and family size, compare benefits and costs, and see the amount of savings you qualify for.
Essentially, everyone qualifies for some type of coverage under the Affordable Care Act. It's finding out which exactly is the right plan for the individual.
Individuals can qualify for expanded Medicaid programs like the Iowa Wellness or the Iowa Choice Plan. If their income levels are above qualifying for those programs, then they would go to the metal plans, which is also more options for, determining what's going to meet their health needs along with the cost associated with each of those plans. One of the benefits, if you have been denied for health insurance coverage before, is that with this program, any pre-existing conditions does not disqualify you from purchasing insurance through the marketplace.
People are entitled to health care coverage under the Affordable Care Act. So in general, they're looking at office visits, testing, specialist referrals, ER visits, hospitalization, the full spectrum of health care coverage.
Who are having a hard time making ends meet, there are different programs that they would qualify for in which there might not be a premium or cost associated in obtaining that insurance. So along with the federal subsidies and tax credits that could be offered to them, they might find out that they would qualify for a program at very little cost, and that would benefit them over the long run.
It's always best to be able to have coverage. That way any catastrophic medical event that's out there will not have create undue hardship for an individual. That's really what one of the core tenets of the Affordable Care Act is, to make sure that people are able to live their life without the fear of, do they have coverage, and dealing with the financial catastrophic events that can be associated if you don't have coverage.
I think that's a great point. As a social worker here at the hospital, unfortunately, we've seen patients and families through the years who have made the decision to not spend the money from their budget on an insurance plan and kind of take the risk or gamble that they would stay healthy. And unfortunately, catastrophic situations do occur, and it ends up costing them a lot more money in the long run than if they had that insurance coverage. It can be financially devastating to have something happen and incur large hospital bills.
You need a primary care provider. You need someone who will really take care of you comprehensively. And you go to see a specialist, for example. That specialist may not always follow you, but they will report to your primary care provider, who will be able to continue the therapy and apply the recommendation of the specialist. It's also taking care of you in total, not just for one single disease. And I think it's very important that people have primary care providers.
Healthcare is currently set up that we can provide a lot of preventative health care in our offices, and unfortunately can sometimes be the hardest place for people to get to and have the most initial out-of-pocket expense. And then they end up in the ER with more serious conditions that have developed as a result of ignoring those preventative health care concerns. And the hospital is the more expensive place for care. It's certainly there when we need it, and also represents a significant cost to the healthcare system. But the goal really behind increased coverage is to get people earlier care and preventative care.
Let's hear from someone who's already enrolled in the new marketplace.
Bob and Janet Boots are breathing a sigh of relief after getting Janet insured through the Iowa Health Insurance Marketplace. She has a pre-existing condition, and she learned her former insurance was going to be canceled at the end of 2013.
They called me and said, no, you're going to be canceled. And I said, okay.
They called, sent several letters.
To make sure I knew I was going to be canceled.
That's why Janet picked up the phone in early December to make an appointment with a certified application counselor to learn more about her options and get enrolled in the new government program.
It only took an hour, basically an hour, maybe an hour and a half, to get enrolled and pick the program I wanted or the policy I wanted and walk right out the door and feel very, very good about it, because now I know my insurance is not going to be canceled. I'm going to be covered. In case I get sick again, you never know.
Janet knows all too well about the struggles of being uninsured. When Bob retired in 2000, he went on Medicare, but she was left without insurance.
When he retired, I lost my insurance. And I've worked 2 jobs, but insurance is very expensive. So for about 10 years, I just did without insurance. I'd never been sick, and so therefore I, thought I'm doing fine. 2 years ago, I got very sick.
Janet was diagnosed with autoimmune kidney disease and spent a number of days in intensive care. Her medical bills mounted to more than $85,000.
Yeah, lots of bills. And some of them have been paid already, and some we're still working on.
In addition to the hospital bills, Janet is on medication that costs nearly $800 a month. Finding affordable ongoing insurance was critical. Access to coverage through the Iowa Health Insurance Marketplace couldn't have come at a better time.
The very nice part is you get a nice tax deduction from the government for this. You can use it per month to make your premium lower, or you can wait and use it at the end of the year on your income tax.
They'll send you a check.
Yeah, they'll send you a check.
There are 4 ways to enroll to get marketplace coverage. First, you can enroll online by visiting healthcare.gov. Second, you can enroll over the phone. Call the Marketplace call center at 1-800-318-2596. A customer service representative can help you apply.
Third, you can enroll with a paper application. If you don't have a computer or time to apply and enroll over the phone, you can fill out a paper application. Call the Marketplace call center to get an application or download a copy from healthcare.gov. And fourth, in-person help. Get help from people in your community, trained and certified to help you apply and enroll in the Marketplace. Visit localhelp.healthcare.gov or call the Marketplace call center.
No one plans to have an emergency, but when it happens, you deserve the best care fast. You deserve the emergency team at Mercy Cedar Rapids. With board-certified physicians, it's door to doctor in an average of 24 minutes. And our single electronic medical record means your health history is always in reach for better, safer treatment, faster. Emergency care at the speed of Mercy. That's the Mercy Touch.
So what information do you need to have handy before you shop?
They need to be prepared to answer questions on their income, current income or predicted income for 2014. They need to have any information if they do have current insurance coverage, the information on those policy numbers and the amounts that they're being charged for that coverage. They'll want to know the Social Security numbers for themselves if they're applying individually, or if it's a family situation, they'll also want to have the members of the family Social Security numbers so that that can also be put into the applications.
So, before you shop, be prepared. Have your Social Security numbers or document numbers for legal immigrants. Have employer and income information for every member of your household who needs coverage.
Have policy numbers ready for any current health insurance plans covering members of your household. And you might need a completed employer coverage tool. This form is available at healthcare.gov. It will help you gather answers about employer health coverage you're eligible for. All family members who work can use this tool. Remember, you may not need all of the information, but it'll be good to have it handy.
If you don't sign up or don't have health care coverage, there's the ongoing problem of not being able to receive early and preventative type health care, and again run the risk of landing in the emergency department or the hospital for extended testing or hospitalization that is unfortunately very expensive, and that will come out on your personal finances without the health care coverage.
It comes to personal preference. When people are shopping for what's important to them, it kind of comes down to two things. One might be cost. That might be a priority for someone. The other might be that they get to stay with a provider that they currently have, and therefore they'll want to find out which of the insurance providers are going to offer them that opportunity.
You have to go to healthcare.gov, and you have to put the information that is necessary there. And you have a choice between different plans, and you have a choice between different companies. And if you are less than 400% of federal poverty level, you will also find out what subsidy you are to receive from the government to help you pay for your insurance premium. Then I think all this together, that's what you have to do. In addition, they are also, we are also here at the university having some insurance fair around the state and different community to help people to get enrolled. And they can also call us here, and we will help them enroll in these different programs.
I think that this is going to be a really good thing for patients. I've seen patients through my career that have made big medical decisions based on their coverage options or lack of options, and I think that this allows patients to have a lot more choice for affordable coverage and comprehensive coverage. The fact that there are now plans required to offer the full spectrum of qualified health benefits, including mental health services, is going to make a huge impact for patients that didn't otherwise have access to that type of care.
I think the promise of the Affordable Care Act is the thing that we're most excited about. I think that the richer benefit package is going to allow us to do more for patients, whether it's in the hospital setting, in the outpatient clinics, or for any home health or other benefits. Whereas today, people may have a limited benefit set, so there's things that we may not otherwise be able to do because of the financial hardship that would create. So I think the ability to coordinate care should be notably better, and hopefully over the long term it will be able to help improve the health status of Iowans.
The example is in my own clinic, that we actually have a clinic that we started here at Mercy for patients who are or underinsured, who are using our emergency department or hospital services to a great degree when we feel they could benefit from primary preventative services. And so we've set up a clinic to provide those, and we've seen dramatic reductions in their utilization then of ER and hospital services because they can get care in a clinic setting. And that's what I would hope that the Affordable Care Act insurance products would support that for a wider portion of our population.
The University of Iowa Health Alliance was put together about 18 months ago. It regrouped the Mercy Health Network, Mercy Cedar Rapids, Genesis Health System, and the University of Iowa. And we get together really to be able to coordinate the care for Iowans across the state in a seamless fashion. Then if people go to one provider in the Health Alliance and they need consultation, or they need access to care for a special condition, this can be done seamlessly. And the second thing is we are also in the process of coordinated the distribution of care across the state for people who want to participate. and making sure that we can control costs and have and deliver the highest quality of care together. And that's really one of the major reasons why we developed the Alliance.
Obviously, there have been some difficulties with the website from the federal government in terms of signing up. Mercy has made a commitment to providing resources to assist people, in addition to working with other community resources that are available to make sure that everybody has the opportunity to get signed up for coverage.
If you happen to be making your way through the University of Iowa hospitals and clinics, we have a vast campus, so we have 3 different locations that are available to assist folks with the enrollment process. General Hospital, the main hospital interest near registration, and over in the Pomerantz Family Pavilion. Our intention is to be able to reach ambulatory patients, whether they're seeing any of our primary care providers or our specialists. And again, we encourage people to seek out those resources, ask questions of any hospital staff that's here to help facilitate and make sure the fundamental goal of getting covered and selecting the provider that's right for them.
We've established the UI Healthcare Benefits Enrollment Center to help patients and families that have questions about this confusing process. Our goal is to make this a little less confusing, a little less anxiety-provoking for people, and so we have an enrollment center.
During my recent physical, my family doctor recommended seeing a specialist. Coordinating my appointments could have been a nightmare. Mercy Care made it easy. Their single electronic medical record meant each specialist and my medical team at Mercy had the same information: my health treatments, recent test results, even any medications I'm taking. Everyone working together helped me get healthy again. That's why Mercy is my medical home. Compassionate, coordinated care. That's the Mercy touch.
If you still have questions, there are several ways to get answers. You can get answers online. Health Exchange coordinators will answer your questions about the marketplace during 2 live chats on kcrg.com. Be a part of the conversation by submitting questions through your social media profiles. Simply use #GetMeCovered in your status updates on Facebook or tweets on Twitter. Then join the live chat or visit afterward to replay the discussion.
We're happy to help. You can contact us at Mercy Cedar Rapids by calling 319-398-6695.
Or contact University of Iowa Healthcare at 319-356-2208.
And remember, visit the websites you see on your screen for additional information.
Thanks for watching.